Doctors say walking is the closest thing we have to a miracle drug for seniors over 60, but here's what almost nobody tells you. Walking the wrong way could be doing far less for your body than you think. Today, I'm sharing the real truth about daily walking after 60, what it actually does for your heart, your brain, and your lifespan, and the mistakes that quietly cancel out the benefits. Stay with me. This could change how you walk for the rest of your life. If you want more science-backed senior health tips every week, hit subscribe right now and tap that bell. Before we get into it, if you're ready to learn the real truth about walking after 60, type, "I'm ready" in the comments right now. It tells me how many of you are serious about getting this right. And trust me, by the end of this video, you'll walk differently. Let's get into it. Let's start with the truth doctors genuinely want you to understand, because the benefits of walking after 60 are real, but they're more specific than most people realize. Your heart. A 2023 study following adults over 60 found that those who walked at least 7,000 steps a day had a 51% lower risk of death from any cause compared to those who walked fewer than 2,000. Walking strengthens the heart muscle, improves circulation, and helps regulate blood pressure, all without the joint strain of running. Your brain. Walking increases blood flow to the brain and triggers the release of BDNF, brain-derived neurotrophic factor, a protein that supports the growth of new neural connections. Multiple studies have linked regular walking to a measurably reduced risk of cognitive decline and dementia in seniors. Your bones and joints. Contrary to what many believe, walking is a weight-bearing activity that helps maintain bone density, which is critical for preventing osteoporosis-related fractures, one of the leading causes of hospitalization and loss of independence in seniors over 60. Your blood sugar. A short walk after meals, even just 10 to 15 minutes, has been shown to reduce post-meal blood sugar spikes significantly, which matters enormously for seniors managing prediabetes or type 2 diabetes. Your mental health. Walking, especially outdoors, reduces cortisol and increases serotonin and endorphins. Seniors who walk regularly report significantly lower rates of depression and anxiety than sedentary peers. Your independence. Perhaps most importantly, walking maintains the balance, leg strength, and mobility that determine whether seniors can continue living independently. Doctors consistently rank walking ability as one of the strongest predictors of long-term independence after 60. So the benefits are real, backed by serious research, and touch nearly every system in your body. But here's where it gets interesting, because not all walking delivers these benefits equally. And that brings us to the myths. Now let's bust the myths, because some of what you've been told about walking after 60 simply isn't accurate. Myth number 1, 10,000 steps a day is the magic number. This number didn't actually come from medical research. It originated from a 1960s Japanese marketing campaign for a pedometer. The real research shows benefits leveling off significantly after about 7,000 to 8,000 steps for most seniors. And even 4,000 steps a day has been shown to meaningfully reduce mortality risk compared to being sedentary. If 10,000 feels overwhelming, you are not failing. You may already be getting most of the benefit. Myth number 2. Any walking is equally good for you. This isn't quite true. A slow, leisurely stroll is certainly better than sitting all day, but research consistently shows that walking at a pace that noticeably raises your heart rate, sometimes called brisk walking, produces significantly greater cardiovascular and cognitive benefits than the same distance walked slowly. Pace matters, not just distance. Myth number 3. Walking alone is enough exercise after 60. Walking is an outstanding foundation, but doctors want seniors to know it doesn't fully replace strength training. Walking primarily benefits cardiovascular health and lower body endurance, but it does relatively little for upper body strength or bone density in the spine and wrists, areas just as vulnerable to fractures. Combining walking with light resistance exercise twice a week produces dramatically better overall results. Myth number 4. If it doesn't hurt, you're doing it right. Some seniors believe walking should never cause any discomfort at all and avoid walking the moment they feel any fatigue. In reality, mild muscle fatigue or slightly increased breathing is a normal and healthy sign you're working your cardiovascular system. The key distinction doctors emphasize is between healthy exertion and actual pain, particularly joint pain, chest discomfort, or dizziness, which are signals to stop and consult a doctor. Myth number 5. Walking on a treadmill is just as good as walking outside. Functionally, yes, for cardiovascular benefit. But research has found that outdoor walking provides additional benefits a treadmill cannot replicate. Natural light exposure that regulates circadian rhythm, varied terrain that improves balance and proprioception, and measurable reductions in stress hormones compared to indoor walking. If given the choice, doctors generally recommend outdoor walking when weather and safety allow. Now that we've cleared up the myths, let's talk about exactly how to walk the right way. So if step count alone isn't the full picture, what does proper walking after 60 actually look like? Doctors generally point to 5 key factors. Factor 1. Posture. Stand tall, shoulders relaxed and slightly back, eyes forward rather than down at your feet. Poor posture during walking, common in seniors with rounded upper backs, reduces lung capacity and increases strain on the lower back and hips over time. Factor 2. Pace. Aim for what's called a talk test pace, brisk enough that you could speak in short sentences, but not comfortably sing. This moderate intensity is the sweet spot for cardiovascular benefit without overexertion. Factor 3. Duration and frequency. Doctors generally recommend 20 to 30 minutes most days of the week, but it does not need to happen all at once. 3 separate 10-minute walks throughout the day provide nearly identical benefits to one 30-minute walk, which is excellent news for seniors managing fatigue or scheduling challenges. Factor 4. Footwear. This is more important than most seniors realize. Supportive, well-fitted walking shoes with proper cushioning significantly reduce joint strain and fall risk. Worn-out shoes, particularly ones over a year old with visibly flattened soles, are a frequently overlooked cause of knee and hip discomfort in senior walkers. Factor 5. Terrain awareness. Walking on slightly uneven natural terrain, like grass or a park path, in moderation, actually helps maintain the small stabilizing muscles around the ankles and ensures better balance reflexes than always walking on perfectly flat, predictable surfaces. That said, seniors with balance concerns should prioritize safety and stick to familiar, well-lit, even paths, especially when starting out. One additional doctor recommendation: the warm-up. Spending the first 3 to 5 minutes of any walk at a slower pace allows joints to lubricate and muscles to warm gradually, significantly reducing the risk of strain, especially for seniors with arthritis. Put together, these 5 factors transform a casual stroll into a genuinely powerful, medically meaningful daily habit. Warning signs to watch for. Now, doctors also want seniors to understand something important. Sometimes, changes in your walking ability are themselves an early warning sign worth paying attention to. If you notice any of the following, it's worth discussing with your doctor, not as a reason to stop walking, but as valuable information your body is giving you. Chest pain, pressure, or unusual shortness of breath during walking that wasn't present before can indicate a cardiovascular issue that needs prompt evaluation. Sudden changes in balance, or a new tendency to drift to one side while walking, can sometimes be an early neurological signal worth checking. Increasing difficulty walking distances you previously managed easily, without an obvious cause like injury, can sometimes point to underlying issues with the heart, lungs, or circulation that are worth investigating. New or worsening leg pain that occurs specifically during walking and resolves with rest, a pattern called claudication, can indicate reduced blood flow in the legs and should be evaluated rather than worked around. To be clear, doctors are not telling you to fear walking. Quite the opposite. They simply want you to listen to your body as a valuable source of information and to treat any sudden, unexplained changes as worth a conversation with your physician, not something to push through silently. So here's the real truth about walking after 60. It is, without exaggeration, one of the most powerful things you can do for your heart, your brain, your bones, and your independence. But doctors want you to walk smarter, not just more. Pace matters. Posture matters. Pairing it with some strength training matters. And listening to your body's signals matters most of all. You don't need a treadmill, a gym membership, or any special equipment. You need supportive shoes, a safe path, and roughly 20 to 30 minutes most days, broken up however fits your life. And if you commented, "I'm ready" earlier, comment one more time and tell me, what time of day do you usually walk, or what's stopping you from starting? I read every comment, and I genuinely love to know. If this video helped clear up the truth about walking for you, please share it with someone you love. A parent, a spouse, a friend over 60 who could use this information today. And don't forget to subscribe to Dr. Ethan Care for more science-backed senior health tips every single week. I'll see you in the next one. Lace up those shoes. Your heart, your brain, and your future independence are all counting on it.